Dr. Gaurish Kenkre is a certified boba therapist from WCRC, South Africa. He's done his motor learning training from Sydney, Australia, and completed his advanced boba training from Porto Alegre, Brazil. He's a credentialed Mackenzie and Mulligan therapist, presently working as a chief rehab consultant in spine clinic at Lilavati and Breach Candy hospitals. He's also a consultant with ICMR Bone Health Clinic and IIT Indore. Presently, he is the director of neuro rehab facility at Atharvability by Lupin in Mumbai, BKC. He is also the chief advisor for rehabilitation at the Center for Spine and Musculoskeletal Care, Search Hospital, Gachirodi, a social initiative. Welcome, Dr. Gaurish, to I Am Possible and SMAART.
First of all, let me congratulate you for kind of bringing this awareness campaign and SMA in the SMA month, creating awareness about SMA as well as kind of people who are suffering from any physical challenges. So this is very important for everybody to know that these things exist and there are problems which have to be kind of taken care of. If you talk about inclusivity, in my view, inclusivity basically starts from our society itself. If you see a differently able person going out in public, there are 100 people staring at them, and that is what makes them more uncomfortable. So our society has to first accept that this is among us, so that's very important. So creating an awareness that this is nothing different, these are our, so it's not handicapped, but it's been differently abled. That is the word which we need to kind of give out in public. That's very important. Inclusivity basically starts everywhere, means going out to the restaurant, going out to the hospitals, everywhere we need to have an inclusive environment where nobody is treated differently.
So, as a caregiver of my daughter, and you've met Kia, right? Kia is only 12 years old, so I've probably not even seen the entire lifespan, all stages of the lifespan with her. But like I was telling you, simple things. In my ecosystem, it's me and her, and my concerns, growing concerns, which brings me to do what I'm doing today, is what happens after me, right, to a child who is so dependent physically. So today we are being asked to spend crores worth of treatment, right, for which we are crowdfunding. So there is no insurance, support, no government subsidy. What we are asking for is that when we are expected as parents to be so conscious about getting that access, do what it takes, somersault if you have to, do whatever it takes to collect the funds, gather the empathy from people. The basic hindrance that I face is the lack of inclusivity. And when I'm talking about this, I'm talking about the psychological inclusivity. Physically, such children are not seen in public spaces. Like you rightly said, you take a child out to a public space and you get stares and glares, right? Uh, Purely because of the way the environments are built, you have to literally handpick them. You have to carry them, through the stairs. You may not have a ramp. And, when you see somebody struggling in a public space, it does come into the limelight, right? I mean, are we only going to expect support from the government? Are we going to expect support from an institution? Where do you think the change really begins?
I've been in practice and seeing so many patients who come on the wheelchair. I have faced multiple issues, and those are the areas where we, in fact, would like to have change in future. Like even in a society where a clinic is running, if you see a wheelchair taxi or a wheelchair car coming, a person getting out of the car, if there is some other car waiting behind, they are not ready to wait. They are continuously honking that this person should go out. So that mindset is not there. So that is the mindset which needs to be created among the society, that you give that time, that much time is required, and there is some person who is really needing it. They take time to get out of the car. I have a patient who stays on the second floor. The relatives
literally have to carry
in a chair, they come down. So again, lift, they have a lift, but the wheelchair doesn't go inside the lift. So again, now in the planning, so whenever you're planning new structure, so those lifts have to be kind of planned in a manner that the wheelchair has to go inside the lift. Going in the outside environment, if you see, we train our patients inside the clinic, but what happens to them outside? They are non-functional. Talk about functional independence, but that independence will not come
you can't
unless
carry it forward.
outside environment improves. So our footpaths are something where the wheelchair can't go. So a person cannot push the wheelchair. There are no ramps to go down the footpath. So all those things, ideally, we will work on a policy making level where we'll have to somewhere bring in the government officials. We'll have to speak to the local municipalities and then make the footpaths in that manner where we can have that inclusive environment. Because till the time these people don't go out, they will not be kind of treated
accepted. They will not be accepted. There's going to be no normalization of their existence, and eventually that barrier in the society will continue both in the mind and in the physical space.
So in Mumbai, in fact, there are some NGOs which are working, and there are some specific changes done in Vile Parle area. So there are small corridors where some BMC wards have taken the initiative to do such changes that the wheelchair can go. There is a small ramp, there is a space for crossing, there is a separate area for differently abled. BMC is divided into different wards. It doesn't work like a whole. So for kind of bringing these changes, you need to kind of talk to the local corporator, you need to talk to the local ward officer, and that person has to sanction. Then there is a big file going in, it runs through, and to bring one small change, you have to run through multiple levels. People have started realizing, and it started. Only thing is, we need to make sure that it's done all over Mumbai, all over the city, and in other parts of Maharashtra, later other parts of India. But there are municipality gardens, at least in Mumbai city, which are kind of adding those facilities where there is a ramp. There are separate areas for differently able sitting for them, wheelchair parking. So those things are being added. So
and I think everybody will agree. You go to a mall, right? A private mall, and there you might find elements which are, providing access to wheelchairs. But right outside the mall, on that road, there may not be that facility, right? So somewhere, I think the public and the private partnership is required. Yeah, it has to partner, because you can't expect the person to suddenly get up and start walking outside the mall, right? Airports, for example. Airports are highly accessible, spaces. Certain food joints, shopping complexes. When you talk about these private public spaces, they are highly accessible. If you do not own a car and you have to travel by public transport, it is as good as a no-go, for somebody who is got any kind of physical challenge. There are certain challenges which are short-term, right? Which can be fixed with therapy with cure, right? And it is not so concerning for the family. There are certain diseases like SMA, could be muscular dystrophy, which are lifelong, right? And they are progressive in nature. Now, in a country like ours, are you aware of any shelter homes, any nursing homes, any rehab centers where accommodation is given to patients? Because there could be some cases where the child outgrows, the lifeline of whoever is supporting the child. So, do we have that concept in our country, or?
There are some homes which are mainly for spinal cord injuries. So there are some centers which are available, but they are more for spinal cord injury, road traffic accident patients. There's one in Pune, but that is mainly for the army people, called Paraplegic Rehab Institute, PRC, Paraplegic Rehab Center, but it's not for the civilians. Then there is some Sashayar home in Andheri, which is again for spinal cord injury, where they admit patients. Then there is one in Sion, again for paraplegic. So most of the centers are for spinal injury patients. I would in fact suggest to get awareness about the other neurological issues which patients are facing, and there is no awareness about this among the people, because there are NGOs who can actually support such system which can be brought about, but we need to kind of create awareness that there are other issues than spinal cord injuries. There are head injuries, there are things like SMA.
Thankfully, in the government hospitals today, and thanks to the establishment of Center of Excellences that the government has propelled, we have SMA clinics which are coming up across the country. And again, it's a association, and I think effort put in both by the community members and the medical fraternity and the government, because not any one organization can create the change, right? Should happen and will happen is that you might need daycare facilities, day and night care facilities eventually. Because
so we call it disability adjusted life years in neurology. So because of neurological problem, if there is muscle weakness, and because of muscle weakness, if your independence is getting compromised, those kinds of patients are many. Means there is a lot of lack of awareness that what they need. Means when some patients, when they come to us, they do different things. They do massages, they do this, that, and then post that they come for rehabilitation. There is a big need gap about neurological rehabilitation, as well as neurological problems, like multiple problems.
So you were, doctor, telling me that you work actively with the Spine Foundation here in Maharashtra, and knowing a little about them, I know that they work at the grassroots level. Could you just tell us a little more about how you manage, within that organization? What are the various tasks that you all undertake? How do you carry out awareness, detection, management, etc.?
So in Spine Foundation, we have a team of spine surgeons, and we have a team of rehabilitation specialists. Started centers or sub-centers in multiple parts of Maharashtra, and now outside Maharashtra in rest of the country also. Where over time we have realized that everybody doesn't need an invasive procedure. Like in spine, if you consider, there are multiple things, like there is a deformity, there is a problem which is like slip disc, there are problems like something called a stenosis. So there are some patients out of 100, if you consider, there are 20 people or 15 people who may need an invasive procedure. 80 of them can be treated just by focusing on their rehabilitation. Some small ergonomic advice and they can get better. Some small form of change in their postures and they can get better. In Mumbai, it's happening so in rural villages too. It's very common that till the time a person with problem comes to a specialist, the problem is not manageable. Means they come with so much of a disability that you can't manage them. So identifying them early is important. Like you spoke about SMA clinics. Clinics are to identify the problem early. If you identify, or if you lose that golden window, you're gone. So this initiative is to identify the person or the problem area at the right time, and then sending them to specialists. So the Spine Foundation has developed over time. Like first, the specialist used to go there and conduct camps, and in camps there used to be 1,000 patients, 2,000 patients, but then the doctors used to get completely drained out seeing those patients. and patients used to be all patients used to be non-specific. Only out of 1,000 there may be 300 who had spinal problems. The rest would have been some ear problem, other issues. So what we did was we started training the locals with the basic identifying scheme. So we started training them with red flag identification, and from that we started screening the patients who needs actual intervention. So the specialist time is used only for intervention. The rest of the things are managed at community level. We also found out is these patients in rural villages, they are daily wage workers. So they coming to a hospital for one day, they lose that day income, that one day income. So they will never come unless they are completely in a problem area. So you have to reach out to them. So you have to go there. So that foundation itself is an NGO. So we support them. So these all patients are treated free of charge. But if you ask me, there are a lot of government schemes which a lot of doctors are not aware of. So there are a lot of government schemes which can be used for these procedures. So most of them fit into those government schemes which can be used in some of the government hospital or civil hospital, and those procedures can be done in those government schemes. Same campaign happens also in Mumbai. So we call it urban poor and rural poor. Adopted one of the BMC hospitals in Mumbai. We are doing the Spine Foundation work in VN Desai Hospital, which is at Santa Cruz, and the same thing happens. So our team goes into the slums. We create awareness campaign. We run camps to identify what is the problem area, and people who really need any procedure, anything, they are kind of diverted to BMC hospital. So we run something called as Spine Foundation Fellowship Program. So this is so we have Dr. Bhojraj and Dr. Nene's team who run for the spine surgeons, and rehab team who runs for the rehab specialist. So we identify a Spine Foundation fellow. We take a commitment from them that we will help them with their private practice, but they have to commit to us for some portion of their practice has to go into rural population or treating the patients who really need.
In terms of the proportion, doctor, children versus adults, what do you see happening in the population of the affected?
There are a lot of pediatric patients also. Pediatrics, most of the problems are with deformity, and they are more challenging because deformity normally is identified at a very early age, and we have to treat it also at a very early age, because if the deformity keeps increasing, you cannot correct it in a good manner. So the challenges are more in pediatric cases, because those corrections are very difficult, and they have to be done by a specialist only. And in the adult population, we have more of patients coming from regular postural problem like sedentary lifestyle, and they get a slip disc. So those things are like, they are more manageable and they can be kind of treated over a long term.
Doctor, one major issue that I face personally, and I'm sure every other rare disease parent will second this, is lack of insurance support, right? For simple health management issues. Why do you think there is such a differentiation when it comes to, having a genetic cause underlying the medical health of a patient? Sort of disqualifying that patient from accessing basic health insurance?
Yeah, so we have tried approaching the government on this. So we have to kind of first create awareness that these things are very long term. There is difficulty which the family is going to face for kind of running these expenses. So insurance is a big problem for this. We have to kind of get it done through the government only. So lack of insurance is something which we are facing in not only the genetic disease, but in the whole process of rehab. When we put papers for insurance claim, the thing what they come to us is, did they take traction? This is the only thing which comes into insurance rehabilitation. Traction
Understood.
was the old way of treating spine, like putting the patient
so
on
that's the only acceptable, you're saying,
insurance.
sort of,
Yes.
label in the insurance terminology. Otherwise, they don't have any newer words that's added on from time to time. This is quite scary, because times have moved and medical science has moved too, and So many options of treatments are available, right? And today, when you're sitting in a state-of-the-art facility, and you know that so many, provisions are possible for a patient. Doctor, why don't you talk to us about Atharva ability? And I have personally visited the center. So, how do you find that different from most of the other centers that you have worked in?
Atharva Ability is a center which is made with the vision of providing care for a neurologically impaired patient. Clinic starts with the idea, as I told you, that there has to be a parking space, because if you have a clinic on the road, a car waiting for a patient to get down, there will be traffic behind in Mumbai. So we from when we started searching the place, we searched in an area where we have an inner compound, so the person has time to get down. Then main thing was to pass on a message of inclusivity. So the clinic is made in a manner that everything is inclusive, like from automated doors. The entry door is automated, so a wheelchair patient can on his own come inside. The reception table is also planned in a manner that one is up and one is down, so that a wheelchair patient and a standing patient can approach the reception together. The reception area, there is a big sitting area. So when we were getting the clinic done, that time I told that it should not be constrained. We have to have open spaces. So we have a big reception for patients to wait there. We have big corridors so the wheelchair can pass through it. So we did it we did a lot of reading. We did some trips to countries abroad to see what they are offering in rehabilitation, and this is what we try to do. So Atharva Ability is a combination of good equipments. We have all the robotic equipments for a patient, and we have all kinds of therapies available. There were two questions, whether to keep rooms or whether to keep an open area. So I had suggested that we should have one open area, so that these patients kind of, because they are going to come for therapy not for 1 or 2 days, but they are going to come there for months. So if they see each other, they get motivated, and that motivation actually helps them to improve.
The feeling that me and Kia got when we entered this space was that of entering a gym, a happy gym. A happy gym space, actually, because you had people playing games to. Nobody looked very sad, and the place is not dingy. It's well lit. So much of space for anybody to move around in their own, equipment if they are coming in, on their own wheelchairs, etc. And I think having all the age groups together is a fantastic idea. Not having to differentiate between a gender and then, having them cooped up in a little chamber. I think it's a fantabulous space. We also know that you'll have like a level where you have aquatherapy and then you have a pediatric section. So, about 2, 3 levels of this, and this is honestly a state of the art. It's a good idea to have, a peep into a place where everything is available, good doctors to equipment to, various forms of therapy, so that they really don't have to run.
Presently, we have some plans to spread out of Bombay, like other cities in maybe in Delhi and maybe in other first-tier cities, and then later again spread out in Mumbai, having sub-centers of Atharva Ability in Bombay.
Anything specific that you would want to, kind of leave them with, since it's an SMA Awareness Month?
Need to be aware that there is a lot of proximal weakness which is there in SMA, and when you are lifting and shifting the patients with SMA, make sure that you don't hold through the shoulders, because you may end up hurting or troubling or dislocating the shoulder. So always hold it from the trunk. That's important. Always have caregivers which are the family, and we have sometimes caregivers which come from outside, like a ward boy or a nurse. So they are not aware about how to transfer. So making sure that they are trained for transferring, how to hold them. Holding positions are important. You don't end up hurting the patient. Also, when you don't take care of the sitting posture, sometimes you may end up kind of putting your body into one position, which may lead to deformities. So deformities are something which are very common, which may be just because of postural sitting. So that has to be taken care of. So make sure that the sitting is symmetrical. the supported sitting, but symmetrical sitting is important. So because the mobility is compromised, you need to identify the pressure areas. So pressure areas are something which are again problems in patients. Like you can develop a bed sore if you are sitting in one position. So keeping a constant change in your posture, identifying the pressure areas, kind of cushioning the pressure areas. These things are important. So we have a visiting orthotist who comes here and he runs a clinic once in a week. So we have right now created everything under one roof. So this will identify the pressure areas. He can kind of give. There are different cushions which are given, but initially it's more about changing the posture, doing things at home, and if we feel that it's not been taken care, then you take the outside things and then support it with
I would
those.
like to mention here, and this is just so that I get to share my experience that I've had with Dr. Gaurish. Ever since I've known him, I think he's been one of the most kindest doctors I've ever come across. Today, Kia is being managed after her scoliosis surgery with a home therapist who is guided by Dr. Gaurish at regular intervals of time. And I think this whole synergy between the junior therapist, the senior therapist, the knowledge share that happens with the patient in mind, with the routine checkups, honestly gives caregivers and parents like me a lot of mental peace. So, Dr. Gaurish, personally, a big thank you from the bottom of this mother's heart. And you've always been a person who says yes. So we need more doctors like you. I do not want to keep you, from going home now. You stay very far away from the clinic, and all of you deserve to have a personal life. So thank you so much for joining me, and God bless you. Hope to see you soon.
Thank you. Give
Thank
my
you, sir.
hi to Kia.
I will for sure. She remembers you, and we'll come and meet you soon.
This person